start today?
Sure. So, so the 10-day EPA's 10-day window is for both. The numbers that they set are accounting for, there's a set of lower numbers for a vulnerable population. So it's assuming for that population, the modeling is based on, exposure by a formula-fed infant.
So I'm just not clear, like if I'm not in that vulnerable population, if I'm drinking the water for 10 days, 20 days, I'm fine. If I'm in that vulnerable population, I'm fine being exposed to it until I get to the 10-day level, and that exposure creates a toxicity or a buildup or a dosage that would precipitate a problem. Is that's which of the two? Both? Because I'm not understanding how it could be both.
Yeah, I'm not entirely following your question, but
so if you're a healthy individual, does the 10-day exposure apply to you?
yes.
So
and
the water.
there are higher levels for. So the concentrations are at two different levels. One lower concentration set of concentration values for vulnerable population, and a higher concentration for adults. And the reason why that is because the vulnerable population that was modeled there are young children who have a smaller body mass relative to the volume of water that they take in, and hence a higher exposure.
I understand vulnerable populations and the definition of that. What I'm not understanding is if the water is safe to drink for the general public, it's safe to drink for more than 10 days.
11.
It's safe to drink for more than 11, hopefully.
Yes. Yeah.
So it's safe to drink for 100 days. It's safe to drink whenever. If I am not a member of that vulnerable community, it's not a concern.
Right. Right.
And if I am a member of that vulnerable community, 1 day's exposure, while concerning and while wanting to keep the information out, it's not until we get to the chronic exposure of the 10 days or the repeated exposure of the 10 days that the guidelines come into play.
Based on the science, it's not expected to have any health effect.
Thank you. And Mr. Emery, just one other question to clarify. So the regulations around tap water versus bottled, because a lot of people in the community went out to purchase bottled water. If you can explain some of the differences between bottled water regulation, there's a little bit of confusion on my part. If this is not a regulated contaminant, is it possible that it's also present in the bottled supply and we wouldn't know because of the testing that's done there? If you can elaborate some.
Yeah, and it's a little bit complicated, and it depends on the source of the bottled water. We don't regulate bottled water in the drinking water program. We regulate public water systems. Some bottled water, it derives from public water systems, and then often is filtered additionally before it's bottled and sold to the public. It's regulated by the Food and Drug Administration, and in Oregon, some water bottlers are regulated by the Department of Agriculture as food.
So does the FDA regulate for the cyanotoxin? Does Oregon Ag regulate for the cyanotoxin?
No.
Just us?
Well, again, we're not regulating, but there are these health advisory guidelines from EPA.
Okay, thank you.
Councilor Anderson.